don't just fall in love with the website stuff or the marketing. If you are able to get a live therapist on the phone or meet with them for a couple of sessions, that is what we would recommend.
These, initial points of contact when you're getting to know a clinician or trying to determine if someone's the right fit for you, I mean, it is really difficult for a lot of people. It's challenging. It's emotionally draining. If you can have those initial conversations with someone and feel like they understood what you were talking about and you felt comfortable speaking with them, even initially, that also tells you a lot about whether or not they might be a good fit for you.
Dr. Burton and I are going to talk about things to consider when you're looking for a therapist or a psychiatrist. I think this is a pretty common question that a lot of people have. And the reason why I think it's pretty common and also a little frustrating for people is that a lot of people who are new to trying to address their mental health, there's a lot of terminology in the mental health space that sound pretty confusing, or if you kind of like read it and you kind of hear about it, it sounds pretty good, but you're not really sure what it actually means. And then you end up actually seeing a therapist or a psychiatrist, and then you realize it wasn't at all what you thought it was. And so Barbara and I are going to try to reduce some of that uncertainty and that confusion so that you have a better chance of having a good fit with the therapist or the psychiatrist that you end up picking.
Yeah, yeah, and so that you have a better idea of what questions to ask when you have your initial conversations with a prospective therapist or a psychiatrist.
Yeah. And Barbara, do you have any specific ways or ideas of how people should think about when they're trying to find a therapist?
I usually like to think of this as a two-pronged issue. Number one, it's important to ask yourself and reflect on what are your goals for therapy. Like, what do you hope to work on during therapy, and what do you hope to get out of therapy? Because that will tell you a lot about what kind of approach might be a good fit for you. And when you speak with potential therapists and you can describe your goals and what you want to work on, it'll help them to also assist you with understanding if they can help you or not.
Sure.
So, what your goals are, first of all, that's important. Second of all, uh, you have to keep in mind that on some level, it is important for you to generally like the person you're working with. And if you're going to do therapy with someone, especially, you're going to be potentially spending an hour a week with them for months, maybe longer than that. And does this person's personality and style, match up with yours? And is this someone you could see yourself being comfortable being in a room with?
Barbara, can you say more as to how someone's goals of therapy are different and how that would impact the search for a therapist?
So, depending on what you might want to address, different types of therapy may be a better or worse fit for you. And so, for example, if you are looking for a therapist who can help you with panic attacks, specifically, you want to work on getting rid of panic attacks. Those are symptoms that tend to respond very well to cognitive behavioral therapy. And so when you speak with therapists about symptoms like that and you want to do that kind of work, um, generally speaking, you're going to be a better fit with a cognitive behavioral therapist than you might be with someone with a different kind of specialization. Another example might be, say you have a pattern of really bad breakups and you have a pattern of having a lot of difficulty in your relationships, and you want to work with a therapist on exploring that and trying to figure out, better ways to behave in your relationships, for example. That would take a different kind of approach. That might be more amenable to psychodynamic therapy. And in your conversations with potential therapists, describing these goals to them can help them, explain to you whether or not their approach is a good match. And that allows you also to have those conversations productively without necessarily having to know the definitions of all of these different terms and all these different modalities. If you can just express what your goals are, it'll help the therapist guide you and give you a good recommendation.
Sure, sure. And I guess what I would say is for a lot of people who are trying to find a therapist for the first time, they just feel bad and they don't have
Yeah,
the words to describe it.
true. Yeah,
And it's totally okay to not have the words to describe it.
absolutely.
But if there's just one thing that you can take away from this point, it's that if you can be able to have a conversation with a therapist or to be able to meet with them for just a couple of sessions, really get a sense of how you feel with that therapist in that room and really think about whether or not you'll be able to work with them for a long period of time. And in the course of doing so, you'll also be able to ask the therapist, do you think that you'll be able to help me with my particular issues? So really, don't just fall in love with the website stuff or the marketing. If you are able to get a live therapist on the phone or meet with them for a couple of sessions, that is what we would recommend.
These initial points of contact when you're getting to know a clinician or trying to determine if someone's the right fit for you, I mean, it is really difficult for a lot of people. It's challenging, it's emotionally draining. If you can have those initial conversations with someone and feel like they understood what you were talking about and you felt comfortable speaking with them, even initially, that also tells you a lot about whether or not they might be a good fit for you.
Another thing that Dr. Burton and I want to talk about is don't fall in love with the credentials of a therapist. Barbara, can you say more about that?
Well, so you will see a broad array of accomplishments, CVs, letters after people's names when you are looking for a mental health professional. And, credentials are meaningful, training is meaningful and important, but it's not everything. And I wouldn't recommend, and I don't think you would recommend either, that somebody choose a therapist solely on the basis of the credentials that they have, because that in it by itself doesn't necessarily mean that they're going to be a great fit for you as an individual. I actually work with a lot of patients who are lawyers. And for them, it's very important that the therapist they work with or the psychiatrist that they work with understands their professional life and understands the way that they think and the way that work affects them. And for somebody like that, a therapist who's very highly credentialed, but doesn't have any experience in the legal world and doesn't understand how lawyers work, that person isn't necessarily going to be a good fit for them. Whereas, a therapist who, maybe has a different type of credential, but has a lot of experience working with attorneys, that person could be a better fit.
And just to say more about this, Barbara and I, we went to the same residency program, and I think it's a pretty high likelihood that there are certain patients that would experience us very differently in
Oh,
our work,
definitely.
and a lot of that is because of the fact that therapists actually bring their own life experiences into the room, and Barbara and I inherently are different people, and so we're going to bring our different experiences. So even though the credentials are the same, we're going to approach the therapy and the psychiatric approach in different ways.
Yeah, exactly.
So if you think about like general things that good therapists should do, you want to make sure that whoever walks into your office feels safe, that you're empathetic, that you're curious. You want to be able to find out more about this person that's sitting across from you. You want to be attentive, and you want to be able to explore whatever it is that's going on in that person's mind. I think in general, all therapists are trained to be like that. And I guess the example that I would say here is how we get there, how a therapist sets up a safe therapeutic space, how a therapist asks somebody how they're doing, or how empathetic they are versus how curious they are. This all really depends on the therapist, so it's all kind of different. And really, the only way to really figure that out is to actually, get in a room with them and try to figure out how it feels.
Yeah, yeah, there are a lot of seemingly small but actually very critical stylistic differences that people have, and that happens naturally just because each therapist is a human being and has different ways of approaching communicating with other human beings, and yeah, and it's really best assessed through real experience with the person in a room with them.
The next thing that I want to talk about with Dr. Burton, with the therapist search, is to be mindful and not try to find your exact carbon copy version of yourself. I think for a lot of people, there's this natural drive to be able to say, what I'm going through, I want to be able to find someone who can understand what I'm going through. And what that ends up happening for a lot of people is that they end up narrowing their search so much that it becomes very hard to find a therapist. Because I think at the end of the day, you as a person are really quite unique, and you're going to run out of particular demographics to search for if you ever want to find your exact carbon copy. But what do you think about this,
Yeah.
Barbara?
Because people are looking for someone who understands them, then like reflexively, they have a tendency to maybe look for a therapist who appears like they're going to understand them, on the basis of characteristics that you can gather from either their appearance or from maybe their background as they state it, like in their resume. But you forget that the way that someone outwardly presents might not necessarily reflect what you assume it to when it comes to their actual life experiences, when it comes to their temperament, their personality, and all of these things play into whether or not somebody's going to make you feel comfortable and whether they're going to understand what you're going through. It's understandable that you want to find someone who knows what you're talking about. But at the same time, it's important to keep an open mind and realize that, your assumptions about what someone will understand might be true, but they might not be true. And so you don't want to limit yourself too much.
So, Barbara, we talked about things to consider when you're looking for a therapist. And I think when it comes to looking for a psychiatrist, there are a couple of other things to consider here. Barbara, can you say more about things to consider when you're trying to find a psychiatrist?
Yeah, well, so many people, when they think about psychiatry, primarily what they think about is medication. And they think about medication management. Less commonly, what people might not realize is that there are many psychiatrists who also practice therapy. Not all of them do, though. There are some psychiatrists who only do medication management and don't have much in the way of psychotherapy training and don't practice therapy. But there are also many psychiatrists who make therapy a central focus of their practice. And it's important to be aware of that, I think, when you look for a psychiatrist, because there are psychiatrists out there who do both medication and therapy. There are some psychiatrists who do more therapy than medication. So that's an important question to ask prospective clinicians, too.
Yeah, yeah. And this is more for people that have already seen a psychiatrist. But if you already know, for example, that you are doing well on psychiatric medications and you're not looking for therapy, you want to be, in the market to try to find a psychiatrist who focuses on medication management. At the same time, if you're just kind of new to this whole thing and you're not sure if you want to take medication or start medication and you're open to kind of both, I think that's an opportunity to be able to work with a psychiatrist who also can provide therapy services.
Yeah, no, I think that's right. And something else, that's worth considering too is, the fact that having psychotherapy training in your background does have an effect on, the way that you might approach treatment in general. And a psychiatrist who has therapy training, even if you're only seeing them for medication management, They might have a somewhat different approach or, style than a psychiatrist who doesn't have that kind of a background. So
Yeah.
that's something else to consider too.
I hear this from some patients who sometimes feel like their former psychiatrists who may be focused on medication management. They may have felt like whenever they met with the psychiatrist, there would always be talk just about medications, adjusting medications, and it felt kind of restrictive to those patients. And again, right, it's not bad or good, but you have to be mindful of what these psychiatrists are providing. And if it is that they're focusing mostly on medication management and that's not what you want, then it may be time to be able to look at other psychiatrists who can do a little bit more and have that therapy training.
Right, right. And it's just important to know, what your options are in the grand scheme of things. And, because there are some patients who might prefer a more, purely medication-based approach, and they might not be interested in,
Yeah.
seeing someone who has a therapy background.
I think another thing when it comes to people having different experiences of psychiatrists, I think it has to do with how psychiatrists view patient autonomy.
This is feedback I get from
Yeah.
patients who come to see me, so it might be, a biased sample.
Yeah.
But feedback that I hear from a lot of patients has to do with generational differences too. That
Say more, Barbara. What are these generational differences?
that is sometimes a more old school psychiatrist might be a bit more authoritative
Yeah.
or paternalistic. Sometimes maybe newer school psychiatry can be a bit more patient centric in terms of decision making and autonomy.
Yeah, yeah, yeah. And again, right, I think that's true. I think that the younger psychiatrists tend to be more aligned with preserving patient autonomy or freedom of choice versus being more paternalistic and saying that you need to take this medication or you need to increase your medication, what have you. And I guess what I would say is like sometimes a more paternalistic approach may actually be better for some people. I think in my experience, like I know that I lean more towards patient autonomy, and I also know sometimes I think about some of my cases where I'm like, oh man, like if I were just more authoritative, maybe it is that this patient would have a higher chance of actually improving their life, and it's something I think about. I wish I could create a copy of myself that's more authoritarian or paternalistic, but I can't, Barbara.
I can't do that either. I found myself having discussions with a couple of patients in the past about that actually, because my approach is also, generally I tend to defer to the preferences of the patient when I think that there's more than one reasonable
Yeah.
path forward. And sometimes it comes to pass that the patient and I both realize that they need someone to be more directive with
Yep.
them. And sometimes, like, that's not necessarily, like, how I am going to do it,
Yeah.
And I've had at least one person who I've actually referred to another clinician specifically because they wanted that. They
Yeah.
wanted someone who is going to be more directive with
Yeah.
them
Yeah, yeah.
in a way that is just not my style.
Right.
Yeah.
Yeah, yeah.